fat was removed from the official dietary guidelines. It entered the culture as a simple directive for better health. The effects of this change would not become clear for decades. This was not an isolated event, but a new pattern for how food would be made. The logic appeared sound. If fat contributes to heart disease, then reducing fat should reduce heart disease. What wasn't immediately visible was what would fill the space fat left behind. The food industry didn't resist this shift, it adapted. And in adapting, it created something new. Because fat serves multiple functions in food. It provides texture, it carries flavor, it creates satiety. Remove it, and the food becomes something else entirely. Something less appealing, something harder to sell. So the question became, what could replace those functions without being fat? The answer was sugar and modified starches, and a range of compounds designed to mimic the mouthfeel fat provided. These weren't presented as compromises, they were presented as solutions. Low-fat yogurt, fat-free cookies, reduced-fat salad dressing. The products appeared in aisles that had previously carried full-fat versions. Sometimes both existed side by side, but increasingly, the low-fat option was positioned as the responsible choice, the choice recommended by doctors, the choice aligned with emerging public health guidance. Most people didn't question it. The medical establishment had spoken. Trusted institutions had reached consensus, and the products themselves were marketed using the language of health. Heart healthy, low in saturated fat, doctor recommended. These weren't fringe products from questionable sources. They were produced by major food corporations. They appeared in mainstream grocery stores. They were featured in nutrition education materials distributed in schools and hospitals. It blended into everyday life. Parents bought low-fat milk for their children because that's what the pediatrician suggested. Dieters chose fat-free dressing because the calorie count was lower. People recovering from heart events eliminated butter and switched to margarine, not because they wanted to, but because they'd been told it might save their lives. The transition felt medical. It felt responsible. It felt like following expert advice. This wasn't discussed openly, not in the way you might expect. There were no public debates about what happens when you remove fat from food and need to make it palatable again. No widespread conversation about the metabolic differences between dietary fat and dietary sugar. No interrogation of whether the studies that showed correlations between fat intake and heart disease had actually demonstrated causation. These questions existed in academic journals, in research settings, but they didn't penetrate public consciousness. The message that reached most people was simpler. Fat is dangerous. Avoid it. Most people never noticed this at the time. The ingredients lists changed, but gradually. Sugar appeared under different names: high fructose corn syrup solids, dextrose, maltodextrin. Each served the same basic function, providing sweetness and bulk in the absence of fat. But because they appeared as separate line items, the total sugar content wasn't always immediately obvious. You had to know what you were looking for. Most people didn't. It seemed too small to matter back then. A few extra grams of sugar in yogurt, some added corn syrup in bread, modified food starch in salad dressing. Individual changes viewed in isolation appeared minor, but they weren't isolated. They were happening across entire categories of food, and they were happening at the same time that portion sizes were increasing, that eating patterns were shifting, that food was becoming more processed in general. The real impact appeared years later, not immediately. That's the thing about dietary changes at scale. You don't see the effects in weeks or months. You see them across populations, across decades, in epidemiological data that takes years to collect and analyze. And what that data eventually showed was unexpected. Heart disease rates didn't decline as dramatically as predicted. Obesity rates began to climb. Type 2 diabetes, previously rare in children, started appearing in pediatric populations. Metabolic syndrome became a recognized medical condition. By the time consequences were visible, habits were already set. An entire generation had grown up consuming low-fat, high-sugar versions of foods their parents had eaten in full-fat forms. The taste preferences had shifted, the industrial processes had been optimized, the supply chains had been established, the marketing had been refined. Reversing course would have required admitting that the initial guidance was incomplete at best, harmful at worst. Then there was resistance to that admission, because the people who had issued the original guidelines were still in positions of authority. The institutions that had promoted low-fat eating still had reputations to protect. The food corporations that had invested in low-fat product lines had financial incentives to maintain the status quo. So the message didn't change, not fundamentally. It evolved. It became more nuanced in academic settings, but the simplified version that reached consumers remained largely the same. Fat is something to limit. This wasn't about individual failure. It wasn't about people making poor choices or lacking willpower. It was structural. The entire food environment had been redesigned around a particular nutritional philosophy, and that philosophy rested on assumptions that turned out to be incomplete. The assumption that all fats affect the body the same way. The assumption that dietary fat directly translates to body fat. The assumption that replacing fat with carbohydrates would be metabolically neutral or beneficial. Those assumptions shaped policy. Policy shaped industry. Industry shaped available options, and available options shaped behavior. If you walked into a grocery store in 1995 and wanted to buy yogurt, the majority of options were low-fat or fat-free. If you wanted full-fat yogurt, you might have found one or two options, often more expensive, often positioned as indulgent or specialty items. The system was designed to funnel people toward low-fat choices. This was designed for scale, not people. The dietary guidelines weren't developed with individual metabolic variation in mind. They were developed as population-level recommendations, meant to be broad enough to apply to hundreds of millions of people across diverse contexts. The food industry's response was similarly scaled. Products were reformulated not for individual health outcomes, but for market positioning, for regulatory compliance, for cost efficiency. And in that scaling, something was lost. The acknowledgement that different people respond differently to different macronutrient ratios. The recognition that whole foods and processed foods aren't metabolically equivalent even when their fat content is similar. The understanding that removing one component from food and replacing it with another isn't a neutral swap. It's a fundamental reformulation with unpredictable effects. The evidence began to accumulate slowly. Studies showing that low-fat diets weren't superior to moderate-fat diets for weight loss. Research indicating that certain types of fat, particularly those from whole food sources, were associated with better health outcomes, not worse. Data suggesting that the replacement of fat with refined carbohydrates might have contributed to metabolic dysfunction at population scale. This evidence didn't arrive all at once. It emerged gradually, across different research groups, different countries, different methodologies. But changing public perception is harder than forming it. The low-fat message had been reinforced for decades. It had become conventional wisdom. People had been told repeatedly by sources they trusted that fat was dangerous. Unlearning that required not just new information, but a willingness to accept that previous information had been incomplete or misleading. And that willingness didn't come easily. There were careers built on the low-fat hypothesis, entire research programs funded to investigate the harms of dietary fat, corporate product lines designed around fat reduction, government programs promoting low-fat eating. All of these created inertia, not through conspiracy, but through the ordinary functioning of institutions that resist fundamental change once they've committed to a particular direction. The shift also affected how people related to food. Fat had been a source of satisfaction, of satiety, of flavor. When it was removed, food became something different. It became something you could eat more of without feeling full, something designed to be consumed in larger quantities. The low-fat cookie wasn't meant to replace one regular cookie. It was meant to be a whole serving, sometimes an entire box, because without fat, the signals of satiety didn't arrive the same way. This created new patterns. Eating that was less about hunger and satisfaction, more about consumption and quantity. Snacking that filled time rather than addressing genuine nutritional need. A relationship with food that was increasingly mediated by labels, by claims, by nutritional calculations, rather than by internal cues of hunger and fullness. And children were particularly affected. They grew up in this environment without memory of what came before. For them, low fat was normal. High sugar was normal. Eating foods labeled as healthy while consuming quantities of refined carbohydrates was normal. They didn't have a reference point for comparison. The dietary landscape they inherited was the only one they knew. Similar decisions followed. Once the template was established, identify a nutritional villain, recommend its reduction, allow industry to reformulate around that reduction. It could be applied elsewhere. Salt was targeted. Cholesterol was targeted. Calories became a primary focus, divorced from nutritional quality. Each time, the pattern was similar. Institutional consensus, public health messaging, industrial adaptation, gradual normalization. And each time, the complexity got compressed into simplicity. Eat less of this, eat more of that, as if nutrition operated on a simple input-output model, as if the human body processed all forms of a macronutrient identically, as if food were just a collection of nutrients rather than a complex matrix of compounds that interact in ways we still don't fully understand. That pattern didn't stop there.